Good morning.
Ba tayo kanina? Hindi siya sinit sa
Maybe it's my hearing, but I thought what was assigned to me was the Asian heart. Asian heart. So, you know, with age, hearing goes first. But I'd like to acknowledge how honored I am to be here, how nice it is to see the college flourish, and that everything we've gotten was built on the shoulders of giants here in this college of physiology. Professors, our anatomy professors, and we owe them a big debt of gratitude. So let me start with a quiz, a demographic survey. Harry Callahan, Derby Harry. This audience, please raise your hands. Who has heard of or watched one of the Derby Harry? All right, you just identified yourself as of a certain generation. And who has never even heard of Derby Harry? And that would be the, okay. And that will be apparent as I get through the talk. I promise we'll come to a full circle. But Dirty Harry, for those millennials, was the tough guy in our era, the 80s. And his favorite line was, signature line was, "Go ahead, make my day." And for us, what makes our days, besides the day-to-day life, is the accumulation of diseases, for better or for worse. This is the natural history of our lives. You'll see, typically, if you do a medical history of an 80 or 90-year-old, a lot of whom I serve, at age 55, they're starting to get their first coronary stent. At around age 59, the clinical trials show that that's about the time they get iliac interventions, especially smokers. Renal artery disease is kind of manifests itself clinically around age 65. That was the CORAL trial when we did the randomized trial for that. Carotid stenosis, blockage of the neck, on average, when you take careful history, is about age 67. So I used to have a professor who said we gather diseases and procedures like the general starts gathering methods. And then, kind of rounding third base here would be end-stage heart disease, organ failure. Leg disease, intravenous arterial disease, about 72 years old. That's about the age of abdominal aortic aneurysm also, right? I see the internists nodding. They look back at their timeline. And aortic stenosis is the next frontier, which we actually put percutaneous valves in. And so the gift of medicine, which most of you or all of you practice, is incredible. We are not only extending lifespan, we're extending the quality of life of our patients. And yet, you know, one of the final terminal pathways is pumping. When the heart fails, life fails. And you see that this increases as we age. And about 1 in 10% of octogenarians and above will have heart failure, even without risk factors. Half of all heart failure occurs in greater than 75-year-olds. And more than 90% of heart failure deaths are in people above 65. So Dr. Pintos, who operates on hips above 65, more power to him. Not easy. And Dr. Pintos, I see in front also, opens all those arteries. And then they call the cardiologist. And this is where it all ends, the end organs, you know. And I'll touch on this later. But when the brain fails and the heart fails, is that the end? Grandfather Greg is here. you ask him that question. But in essence, I'll touch on how age affects the pump. We'll take physical or deterministic view of this as science has shown us since the Enlightenment. So the pump, the main highway, it's like EDSA, the aorta, and the arterial tributary. It gets trafficked also as it gets cold. And the electrical system that coordinates the mysterious motions of the heart. And before that, what we're trying to do in the research arena, both here and abroad, is looking to see whether we can prevent any of these spinal illnesses. Which frankly, I think prevention stage or preventing aging seems to be almost an oxymoron. Hard to prevent birthdays. Your point is to have more birthdays. And Dr. Quintos told me that one of your endocrinologists gave 144 slide talk last year. So I cut mine down to 130. Really have to feel but in essence, you know, you've all learned this in med school. Otherwise, you have to demand your money back. In essence, just to summarize, I want to torment you with each and every one of this. There's a proliferation of smooth muscle cells. The matrix is laid in supple arteries and heart. Enzymes come online that melt away the rubber band elasticity, the suppleness. We're beginning to lose myocytes, heart cells, where calcium handling is a little less orderly and increased arterial pressure. So in other words, nagiging makunat tayo. Just a cold state. At least the physical part. And the bottom line is these are the effects. Things enlarge. The atrium enlarges. The ventricle may enlarge or become smaller, you might see, but in essence enlarge. Arteries become thick. Especially if you had a big breakfast there, you can feel your left main congealing now. Don't worry, Dr. Pigrino, who was chief at the Phoenix VA, I heard he just did an ACLS. He can put a new heart. And then it's stiff, una. So larger aorta, larger heart, thicker arteries, stiffer head.
Wala na ba ibang
Simple, huh? Other changes with ages, you know, decreased nitric oxide, decreased gene expression of proteins that regulate calcium handling, and decreased cardiac reserve. Bottom line, fibrosis, scarring, apoptosis, and cell deaths. The compensatory changes, so the body adapts to loss, to changes, and what this is I'll concentrate on the middle column, which is there's increased pulse wave velocity, which I'll elaborate on, increased aortic impedance, resistance to the heart. The heart ends up working harder to push blood to all the rest of the body. And therefore, the left ventricle, like the muscle, is programmed to hypertrophies, to cope with the stress. It thickens to be able to, in essence, fulfill the law of Laplace, physical law that you know, to decrease the wall tension. It has to thicken and compensate. And we'll focus on the left corner, LV wall thickness, which is that particular hypertrophy. And you can argue whether it's natural to expect with age. Most people will have it without any heart pathology. It's just aging physiology. The line is blurred where it crosses over. This is to normalize the LV tension, because if you imagine a balloon, a big party balloon, if you blow it up more pressure, the wall ends up. well, biologically, the heart can create more cells for hypertrophy, like people who do weights, hypertrophies, so that you can preserve the cardiac output. So it's a miracle. It's just fearfully and wonderfully made. And here are the compensatory changes in the aorta. So this is a young supple heart. Those of you who barely know who Dirk Harry is, this is what happens. So we pump it, the heart pumps, the aorta expands to the pressure like a rubber band in the young. And then when the valve is closed, it continues pumping the blood, and therefore pressure of 120 with systole, the elastic band expands, and then it contracts to give you a diastolic pressure to fill the coronaries. And these are nice, smooth, synchronized cycle. As we grow older, remember, thicker, stiffer, more peripheral vascular resistance. And if you could imagine a cup that's stiff, and if you push water and agitate water, hits the wall, comes that typhoon, hits the wall, there's reflected waves. And as our arteries and the aorta stiffens, there's no more give or elasticity. There are reflected waves that are in fact almost competing or augmenting the systolic pressure, and therefore you have higher systolic pressure from the LV and from the reflected waves. And this waveform is those of us, they have Freudian slip, those of us who are young, class 90%. And then these, what class am I going to pick on? I won't pick on this is the blood pressure pattern of isolated systolic hypertension. And the heart-rate part, we all have relatives that ask you, why is my blood pressure this? The upper number is too high, the lower number is too low. Why is the doctor afraid of giving me more medications? Why will I faint and all that? Well, it's just how it is. Dr. Negrino is an expert. He knows more about diastolic function than I. In essence, I can simplify it. Albert Einstein once said, keep things simple, but not too simple. But I'll try to make it too simple. Because I'm just a knuckle-dragging intervention. So, poor relaxation of the heart. So relaxation. It's the Sabbath of the heart. So if you think about respiration, what does respiration consist of? Inhale and exhale. No exhale and inhale. And in essence, the heart, as it's conceived before, was all pump, all work. But really, for 2 decades now, we're beginning to understand that the heart that relaxes is a heart that's strong and will pump much. Athletes are able to run and increase their cardiac output by 5 times, not by virtue of systole, but by virtue of diastole. Their lungs expand, their heart expands, supple, and with each beat, cardiac output is enough to sustain that high level of activity. And as the heart grows stiffer and thicker, it less relaxes, less and less. Now, for those of us nerds, I think the William Grossman, in the first edition of our landmark textbook of interventional cardiology, he wrote, "To Sarah, the diastole of my heart, the diastole of my life." I said, how romantic. Showed it to my wife, she didn't quite think it was Becky. Romantic. But we need both systole and diastole. We need both work and what's ordained as Sabbath. Look at the athletic field. You know, this guy is ancient in the eyes of my kids. 39 and washed up, Kobe Bryant. And this is the peak VO2, peak oxygen consumption. You know, when they have sports physiology types, Nike or high performance athletes, they put in a mask to measure their oxygen consumption and all that. This is us in our 20s, 30s, and after 40, we start declining. Pulmonologists in the room will probably agree with me that after age 40, it is about 1 ml of lung capacity per year. And so it is true with renal cells and all that. Facts of life. And finally, I mentioned to you for the heart standpoint, decreasing electric function, less organized. So what we see are P wave, PR interval increase, QRS axis leftward shift and all that. All of these changes really don't have much impact on mortality. So for those of you who are doing internal medicine, doing a clearance for operations and all that, it's just part of the landscape of the 60, 70, and 80. QT interval may be related to some of the medications that can increase QT, so we have to be more mindful of that in the elderly. And also, maybe the calcium handling of the heart cells. The heart gets disorganized too, like a room full of middle-aged, middle schoolers. You know, so the upper chamber wants to have extra outbursts, little supraventricular extra beats, their ventricular PVCs, extra beats, and all that. And everything also, while on the ECG looks ugly and concerning, really probably does not have a large impact in the long-term scheme of things, with the exception, the very important exception of atrial fibrillation or flutter, because that can cause, it's a whole day session in itself. It can cause clot in the left atrial appendage chamber, which we now have devices to plug off. And therefore you can impact that, lower the risk by giving anticoagulation. It can, with the loss of the atrial kick, remember, you have to get that extra push from above, from the receiving chamber to the LV. When you lose that atrial kick, your patients feel tired and wiped out. And so that gives you an appreciation of how important the order of things are, the synchrony of things are, from atrium to ventricle to the pulmonary or arterial circulation, and then back to the same subject. And the disruption of that order means disorganization. So sadly, you know, the second law of thermodynamics, which is entropy, that is the order of things, which is all things over time degenerate to more disorder. So our elders' nemesis, or our own nemesis when the time comes, is pump failure. Aches and pains everywhere, osteochondritis, muscle pain, and all that. And it's hard to disentangle all of that from heart disease, and that can mask heart disease. And then there are those that admire. I have patients whose heroes are Dirty Harry and John Wayne, Tom Brokaw's Greatest Generation. They simply won't complain unless you take the time to sit there. You're patiently waiting, see who speaks first, and then finally say, oh, by the way. Or better yet, if it's a family visit, it's always the daughter who tells you the good stuff. The middle-aged daughter, or the son who tells you, no, it's not true. He's having chest pain, she can't sleep at night, and all that. But mom, what are you saying? You're perfectly fine. So it's a communication disorder that we're also developing, both in our hectic practices and as people grow older. And trust me, in the United States, this communication disorder is becoming of epidemic. And why is that important? Because for systolic heart failure, meaning the LV, the left ventricle ejection fraction has dropped, we can do so much. About maybe a 20% impact on survival or hospitalization. And in essence, this is not the purpose of my review today, but ACE inhibitors and beta blockers over the research of the past 3-4 decades have impacted, and it is beneficial from the worst rest dyspnea to asymptomatic patients. It impacts ACE inhibitor beta blocker, the cornerstone for LV less than 45, less than 40%. Diuretics and aldosterone probably for the worst case, more symptomatic cases of LV failure. How about diastolic heart failure, which comprises about half of patients with heart failure? Meaning, the echo, you get this report all the time, the echo is normal, and therefore, you must be normal. Nope. They're feeling congested, the thick heart can't pump the blood, it becomes pressurized, and then that pressure is transmitted to the lungs, and they can't breathe, and then they can't get to the bathroom, they can't finish bathing, and they just say, oh, I'm just getting old. It's diastolic heart failure. And Lasix, we've made people breathe. There's some tricks in the trade. One subliminal nitro, and suddenly the patient was able to go to the bathroom, and she said, can I have some of that to take home now? We're not allowed any samples anymore. But I hide some. So the Lasix is so underutilized in this cohort, where we can make them just a little moving up from the heart failure class means they can get to the bathroom on their own, they can sleep flat, they can eat and have an appetite, and they can shower. And fundamentally, at the end of life, it's the same basic things as the beginning of life, which is you ensure that they sleep well, they eat well, and they're clean well. That's all I ask for. And that's the most difficult because it's time, the lack of time. And it's not because of lack of time that we don't have anything for, oh, this is okay, we'll just repeat all. Trust me, I know what I'm doing. Not bad for an interventionist, huh? Let's see if the surgeon's doing this. Okay. So, after those 17 trials, 17 multi-million-dollar trials, so this is your CME, right? It's one of the goals. This is the list of things that can lower the death rate for diastolic heart failure. Entire list, take down the note. After 17 trials. Haven't found anything yet. Okay, so actually getting done now. 5 minutes. Alright, and this, I think this is the fun part to me. The many meanings of heart. So, okay. Heart is one of those words that have a wide lexical range because it's just over the ages imbued with many, many different things. So, you see, I'm heartbroken. So it's implied that it's the seat of emotions. It even crosses culture. In Tagalog, diba? I'm hard. Okay, so I know in my heart, I know what's brain, right? I know. I thought my kids were going to be here to listen to me. Okay, so mind and wisdom. In the ages, before the Enlightenment, before the 17th century, it was the seat of everything, the seat of the soul, the seat of the mind. My heart tells me no. And I hear Father Greg is hearing confession at the break. So, and then I had a heart attack that now, after the era of dissection, anatomy, science, no more taboo in dissecting the heart. Now, we view it as a physical organ. And the gifts of medicine can, in fact, has done amazing things to prolong people's lives. Like this. Who knows this? This is a 23-year-old Jennifer Sutton, and this is her expanded heart. She had a heart transplant. So in the old days, you know, when somebody says the heart has stopped, cardiac arrest, that means the patient was dead. Doesn't look dead to me. And carry that thought experiment forward. Who in this audience can imagine a day when Jennifer Sutton will be staring at her brain? I'm just curious now. People raise their hands as to who Father Greg, you can take notes. Who actually, I think there will come a day when she's looking at her heart, her brain, her kidneys, right? So, if we fast forward maybe 2 more centuries, will the definition, will brain dead mean death? In one sense, certainly maybe the physical. Is Descartes actually right? Cogito ego sum. I think, and therefore I am. But what of the augmentations and enhancements of this era? So, which one is fiction and which one is real? Iron Man. But you know, there are athletes now that and veterans now, war vets now that have augmented, you know, suits that help them walk. Wakeman is one of the 4 centers that have that rehab capacity to help them augment. And in Japan, they're having suits, robots that augment people. So 50 years from now, I'm expecting to do this. And then all my armor comes. And I can walk to the bathroom. The bathing part will be hard. Okay. And then, how about Google Glass is here. How many of you use, I don't even know how to pronounce it, Waze? Coming here. How many of you use Wikipedia? How many of you watch YouTube for instructions instead of reading the manual? Are you still using your brain? You don't have that. I mean, we even outsource the brain. So how much thinking does it qualify? Does it qualify to be human? Or is that not the place where we ask the definition of being human? This is Stephen Hawking, right? Stephen Hawking. ALS, Lou Gehrig's disease. It really is upper and lower motor neuron disease. I'm not going to lie to you, sir. Dr. Tony is a neurologist, and I don't want to get on the wrong side. But in an Alzheimer patient that can still smile, laugh, remember once in a while, somebody's still there. So I'll come full circle. Beyond the heart and beyond the brain, Dirty Harry. So Clint Eastwood. In his 30s and 40s, he did the Tough Guy movie, had to pay his dues. At 62, he was beginning to follow his passion, directed the movie Unforgiven, and for which he won his first Oscar. At age 74, second Oscar for $1 Million Baby, Best Picture. And then, who saw this movie? I still haven't seen this movie. Letters from Iwo Jima. A very deep, a masterpiece. Art critics, even the New York Times, believe it or not, proclaimed that it was a masterpiece. And this macho guy, really laying bare the ambiguities and complexity of violence and war, and the casualties of everybody involved. Okay, another pop quiz. After an election in 2013, George Mario Bergoglio school teacher in Great Neck, New York. Sculptor also. Made Spider at 88 years. Champagne. Oscar Hammerstein at 64 wrote the lyrics to Sound of Music. Nelson Mandela at 71, released from prison, transformed the nation. Michelangelo at 72 designed the Dome of St. Peter's Basilica at 72. Benjamin Franklin invented the bifocals that are helping most of my classmates. Frank Lloyd Wright at 91 completed the Guggenheim Museum. Dimitrion Jordanis at 98, Athens Marathon in 7.5 hours. And Ichijuro Araya at 100, climbed Mount Fuji. So it may not be in our physical heart, it may not be in our physical brain. And perhaps, the ancients were right. Perhaps the ancients were right in that there is a mind, there is a body, there is also a soul that's separate. And I could never figure out why the Synoptic Gospels included in all your strength. Someday I'll figure that out. And so to summarize, what I've tried to do today and hope I've imparted is that the cardiovascular system will age. Accept it. The heart of the ages, let's seek it. And the heart of the ages, let's live it. And I'm glad I'm glad I'm finding, as I see all my classmates, I'm finding them to be all very, very good.